Good evening, everyone. So, my next video, which I'm going to discuss with you on anti-helminthics part 2. Other left drugs I will discuss with you in this video. And before I start my video, I want to request you if you like this video and if it is helpful and useful to you, kindly subscribe to my YouTube channel that is Dr. Nitika Pharmacology Discussion. And now I'm going to discuss with you some drugs which are used in the helminthic infections. So first is levamisole or tetramazole. Levamisole is a levoisomer of tetramazole, active against nematodes. It's also active against nematodes, but used restricted to Ascariasis and Ankylostomiasis as second line drug. Mechanism of action is the ganglia in the worms are stimulated, causing tonic paralysis and expulsion of the these are these, as you know, this is the immunostimulant. So the ganglia in the worms will be stimulated and it will cause a tonic paralysis and there will be expulsion of the live worms. Interference with carbohydrate metabolism is also there. So there will be no generation of ATP. So it is used in the ascariasis and in ankylostroma. The dose is single dose 150 milligram for adults and 100 milligram for children. 20 to 39 kg body weight and 50 milligram for 10 to 19 kg body weight. And chylostoma, two doses at 12-hour interval is given. Next drug is niclosamide. It is the drug which is useful drug for the tapeworm infestation. And its mechanism of action is it is rapidly killed by inhibition of oxidative phosphorylation or stimulation of ATPase enzyme. So there will be inhibition of the oxidative phosphorylation or stimulation of ATPase enzyme. So there will be no synthesis of ATP, thus killing of the cestodes. And thus pharmacokinetics is poorly absorbed from the gut. Neither drug nor its metabolites are found in blood or urine. So niclosamide it is used in the beef tapeworm infection, Tinea saginata, Tinea solium, pork tapeworm infection, diphyllobothrium latum fish tapeworm infection. 2 gram of a single dose is given in the morning on the empty stomach and not effective against cysticercosis or hydrated disease. Haminolepsis nana, it is effective against adult parasite. Adverse reactions can cause the GI disturbances and alcohol consumption should be avoided and it is not indicated in children under 2 years of age. Diethyl carbamazepine, it is a drug of choice for the treatment of the filariasis, loesis and tropical eosinophilia and it is a synthetic piperazine derivative. It rapidly absorbed from the gut. It has a half-life of 2 to 3 hours which increases in alkaline urine to 10 hours is excreted in the urine unchanged and dosage is reduced in urinary alkalosis and renal impairment. Mechanism of action of diethyl carbamazepine is it causes the alteration of organelle membranes of the microfilariae promoting the cell death. Means the organelle membranes of the microfilariae will be altered and that will lead to promotion of the cell death. Immobilizes microfilariae and alters the surface structure, making them susceptible to destruction by host defense mechanism. Means they immobilize the surface structure of the microfilariae, and then it will be susceptible to destruction by host defense mechanism. It is not teratogenic. It is a drug of choice for Victoria bento of the Brugia melai, Brugia timori, and Loa Loa. Microfilariae rapidly killed. Adult forms are killed slowly requiring several courses of treatment. Microfilaria, they are killed rapidly, and adult worms are killed slowly. It is highly effective against Loa Loa for these infections. The dose is 2 milligram per kg 3 times a day for 2 to 3 weeks. For Wucheria bacteria infections, to reduce the incidence of allergic reactions to dying microfilaria, a single dose is administered on the first day, 2 doses on the second day, and 3 doses on the third day. Means to reduce the incidence of allergic reactions to the dying microfilaria. So a single dose is administered on the first day, 2 doses on the second day, and 3 doses on the third day. For Loa Loa, there is risk of encephalopathy or Brugia mili infections, individual doses should start at 1 milligram per kg once on a on the first day and gradually increased over 5 to 6 days. Antihistamines and corticosteroids are given in allergic manifestations. Complete cure may be required. Several doses may require several doses of treatment over 1 to 2 years. The drug may be used in prophylaxis and 300 milligram weekly or 300 milligram on three successive days each month for loesis and 15 milligram monthly for broxifen and mammalian filariasis. Topical eosinophilia 2 milligram per kg three times daily for 7 days. So this is the dose for the Wucheria bentopty infection for the malayan Brugia filariasis or loesis. 300 milligram weekly or 300 milligram on three successive day each month can be given, or 5 milligram monthly can be given, and for tropical eosinophilia 2 milligram per kg three times a day for 7 days can be given. So what is the reaction of the drying microflaria is there can occur fever, malaise, papular rash, headache, GI disturbance, cough, chest, muscle, joint pain, leukocytosis, retinal hemorrhage, encephalopathy, lymphangitis, or lymphadenopathy can occur. This is the reaction which is caused by dying parasite. When the microflaria of the parasite is killed, the reaction in the body develops. Contraindications are hypertension, renal disease, patients suspected of malaria, patient with lymphangitis. So next is ivermectin. It is the drug of choice for the treatment of malaria and onchocerciasis and elephantiasis. It is a microcyclic lactone. It is used orally and rapidly absorbed, possesses wide volume of distribution. It has a half-life of 16 hours. It is exclusively excreted in the urine. Mechanism is ivermectin. It intensifies the GABA-mediated transmission of the signals in the peripheral worlds. Preservative paralysis of the signals in the peripheral nerves, and GABA-mediated transmission will be intensified, leading to inhibition in the peripheral nerves. In onchocerciasis, and it is microflaricidal. It doesn't kill adult worms. Onchocerciasis, a single dose of 150 milligram per day with water on empty stomach repeated after every 3 months for 1 year. After this, it is repeated yearly until adult worm dies, which may take a year or more. Strongyloidiasis, 200 milligram for 2 days in immunosuppressed patient. Repeated treatment is needed. Pencroftì flaricidal, it is a microflaricidal in Pencroftì filariasis. It is also used for scabies and cutaneous larva migrans infection. Adverse reactions are fatigue, dizziness, GI disturbances. In onchocerciasis, it causes the Mesotti syndrome, in which there is fever, headache, dizziness, somnolence, weakness, rash, diarrhea, arthralgia, hypotension, lymphadenitis, peripheral edema. Due to killing of microflaria, for this, steroids may be necessary for several days. Is to treat it, we give steroids. Swelling and abscess at site of adult worm can occur, and punctured corneal opacities can occur. Contraindications are as it it acts by GABA mediated stimulation. So its action will be enhanced by barbiturates, benzodiazepines, valproic acid, and pregnancy is the contraindication. Impaired blood-brain barrier, children under 5 years of the age. Bithionol, it is the drug of choice for the treatment of fascioliasis, which is the sheep liver fluid. It is also alternative drug for pulmonary paragonimiasis. Pharmacokinetics is orally absorbed and excreted in the urine. Clinically, it is used in the dose of the 30 to 50 milligram per kg in 2 to 3 divided doses administered orally after meals on alternate day for 10 to 15 days. Adverse effects: GI disturbances, dizziness, headache, pruritus, urticaria, leukopenia. Contraindications and precautions. Hepatitis leukopenia used in caution with 8 years of age, children under 8 years of age. So praziquantel, this is useful against cystosomes, other trematodes, cestodes, but not nematodes. And rapid absorption with high first pass metabolism causes blood-brain barrier, short half-life, excreted chiefly in the urine. Phenytoin, carbamazepine, dexamethasone can induce the metabolism and reduce the bioavailability of praziquantel. Mechanism of action, it causes the leakage of intercellular calcium, contracture, and paralysis of the worms. Means it will cause the leakage of the intercellular calcium, leading to contracture and paralysis of the worms. Adverse effects are no systemic toxicity, bitter taste, nausea, abdominal pain, headache, dizziness, sedation, itching, urticaria, rashes, fever, body ache when used for pistil fluids and cystosomiasis. Uses are tapeworms for the tinea saginata, tinea solium. The dose is 10 milligram per kg, single dose in morning. For hemonolepsis nana, diaphylum bothrium latum, 15 to 25 milligram per kg, single dose in the morning. For neurocystic psychosis, 50 milligram per kg daily in 3 divided doses for 15 to 30 days. For cystosomiasis, 40 to 75 milligram per kg given once daily. Other flukes, 75 milligram per kg single day treatment. So anthelmintic treatment of the neurocystic psychosis is why we give the albendazole is preferred over the praziquantel is because for the neurocystic psychosis, the course of treatment is shorter, that is 18 to 8 to 15 days, and compared to praziquantel, which is 15 to 30 days. Cure rates in terms of the resolution of symptoms and disappearance of cysts are higher. The symptoms will resolve more easily, and cyst will be disappeared 70 to 85% with albendazole, and praziquantel is 50 to 60%. Corticosteroids enhance the absorption of albendazole and but lower levels of praziquantel. So albendazole is cheaper. So corticosteroids, prednisolone 40 to 60 milligram per day or dexamethasone 8 to 12 milligram per day must be started 2 days before and continued till 2 weeks after completing the anthelmintic course to suppress the inflammation of the products of the kill larva. We give the corticosteroids. Absorption of both the drugs increases with the food. Anticonvulsant can be given if seizures occur, like phenytoin and carbamazepine can be given. Used for indefinite period 1 to 6 months. Thank you. That's all with the treatment of the anti-helminthic infections. I hope you understood this video, and if you understood this video and if this is useful and helpful to you, kindly subscribe to my YouTube channel, that is Dr. Nitika Pharmacology Discussion. Thank you. Be happy, be blessed, stay safe, happy learning. All the very best. Thank you.